It's Wednesday, March 11. This is the news on PBCJ. I am Simone Absalom. Jamaicans have been given an $18 billion tax cut for the 2020-2021 fiscal year. Minister of Finance and the Public Service, Dr. Nigel Clark, made the announcement in the House of Representatives as he opened the 2020-2021 budget debate on Tuesday. He says the measures support the 2019-2020 tax reform that saw reductions in tax rates and the elimination of some tax types considered distortionary. Among the three tax measures addressed were the General Consumption Tax (GCT), asset tax for businesses, and a new income tax credit for regulated and unregulated companies with annual sales less than or equal to $500 million.
Mr. Speaker, effective April 1st, 2020, the standard rate of GCT will be reduced by 1.5%. 1.5%, Mr. Speaker. Be responsible. Mr. Speaker, the standard rate of GCT, effective April 1st, 2020, will be reduced by 1.5%. This year, Mr. Speaker, we're not just abolishing distortionary taxes that small and micro businesses face, Mr. Speaker. We're going to give back to small business, Mr. Speaker.
Dr. Clark told the House of Representatives that the potential cost of the reduction was approximately $14 billion, but added that despite the potential revenue loss, it is expected that the tax would continue to perform. Dr. Clark also announced that the government will reduce the assets tax rate from 0.250% to 0.125%. He recalled that the assets tax was abolished for non-financial institutions effective 2019 as an initial step in reforming the tax type. This resulted in the lowering of the costs to the micro and small business sectors while better aligning taxation with profitability. The new rate would come into effect on April 1. $7 billion has been earmarked in contingency funding to tackle the COVID-19 viral threat. Finance and Public Service Minister Dr. Nigel Clark made the announcement during his contribution to the 2020-2021 budget debate in Parliament Tuesday. Dr. Clark indicated that if the virus became more pervasive, the government had resources to respond.
The primary balance reduction, which arises from the acceleration of debt repayment, will be used to finance a $7 billion COVID contingency in the 2021 budget to provide for any broader impact of the COVID virus should that materialize. $7 billion, Mr. Speaker.
He said that the government was providing an advance of $2 billion from the 2020-2021 budget to facilitate immediate preventative and preparatory spending. This amount would be reflected in the first supplementary estimates of expenditure. Dr. Clark said the funds would be expended and would be designated to prevent, control, treat, and contain the virus. The National Operations Emergency Center has been activated. It will coordinate efforts to address the coronavirus. The Minister of Health, Dr. Christopher Tufton, also named a COVID-19 response advisory team that will support the Health Ministry's planning and coordination with respect to the virus.
The members of this advisory team for the Ministry of Health and Wellness are Mr. Howard Mitchell, former president of the Private Sector Organization of Jamaica, Mr. Christopher Zaka, who is currently president of Sagicor, CEO of Sagicor, Mr. Owen Ellington, former Commissioner of Police, Reverend Devon Dick, Jamaica Baptist Union, Dr. Marina Rankisoon, Deputy Associate Dean, Faculty of Social Sciences at UWI, Commander Wenz Gorman, and Lieutenant Colonel Sidney Powell of the JDF and ACP Calvin Allen of the JCF.
Dr. Tufton has urged the public to adhere to infection prevention and control measures.
I would like to advise the public to continue to observe and perhaps strengthen their sensitivities to public gatherings, which we are discouraging, non-essential travel. We continue to patrol irregular border crossings, sensitization of key personnel at all air and seaports will continue.
In the meantime, another appeal has come from the government for persons not to engage in panic buying in light of the first confirmed case of the coronavirus in Jamaica.
I would like to use the opportunity to appeal to the public to remain calm in the face of this most recent development and to implement all the advisories related to personal hygiene, social distancing, and overall infection prevention control. I'd like to reassure the public that the government of Jamaica, the Ministry of Health and Wellness, is doing all that is necessary.
The Medical Association of Jamaica, MAJ, has called on medical practitioners and members of the general public to remain calm in light of the arrival of a patient with COVID-19 to our shores. It also urged the public to pay attention to the releases and advisories from the Ministry of Health and Wellness. Amid the first imported case of the coronavirus in Jamaica, Prime Minister Andrew Holness says schools will remain open. Mr. Holness told the media at a press brief that an allocation has been made to schools for them to acquire hand sanitization products to protect against the illness.
As it relates to schools, we have made financial provisions, recently announced by Minister Samuda, for schools to acquire hand sanitization products, as schools will continue to be open unless the government of Jamaica directs otherwise. It is no cause for panic. We will now diligently activate the plans we have made to isolate the cases, to trace and identify the cases of contact, and contain the potential spread. So go about your normal business. However, pay close attention to the advisories and information provided by the government. Increase the awareness of your own health and the health of those around you.
He said the government will monitor the situation hourly and make further decisions where necessary. Meanwhile, Mr. Holness was asked about the implications of the coronavirus on the calling of the general election. The Prime Minister said, while democratic institutions must be protected, the health of the nation takes priority in every consideration over elections. He said the country must now refocus its attention to ensure there is no community spread of COVID-19 in Jamaica. Meanwhile, Minister of State in the Ministry of Industry, Commerce, Agriculture and Fisheries, Floyd Green, says key stakeholders in the distributive trade have been ramping up production of food items in light of the threat of the coronavirus. Speaking at a special meeting of the distributive trade at the ministry's Hope Gardens offices in St. Andrew Tuesday, the minister said the country seems to be fairly secure with basic food items. Discussions surrounded the strategies being implemented by businesses to deal with the threat of the disease, levels of business readiness, and the availability of a business continuity plan should they be affected by the coronavirus, among other things. 3 European countries have been added to the list that Jamaica has restricted travel to in light of the coronavirus outbreak.
In addition, imposed travel restrictions remain in place. In fact, 3 countries have been added to the list of the 5 that were originally announced. China, Italy, South Korea, Singapore, and Iran are the original countries. That was previously made public. We have added to that Spain, France, and Germany.
Health and Wellness Minister Dr. Christopher Tufton was speaking at a press conference Wednesday at the ministry's New Kingston offices. In a related story, the number of coronavirus cases in the United Kingdom has now reached 373, a rise of 54 from Monday's figure. Also, British MP Nadine Dorries, a minister in the health department, has tested positive for coronavirus, raising concerns about whether senior government figures have been infected. In the United States, New York Governor Andrew Cuomo has announced a 1-mile coronavirus containment zone around the town of New York City. It's north of New York City. He said New Rochelle has seen probably the largest cluster of U.S. cases. National Guard troops will be used to clean schools in the town and to deliver food to any quarantined individuals. J. Ray and Nephew Limited suspended operations at its Spanish Town Road offices as a precaution amid Jamaica's first corona case. J. Ray says the patient had close contact with one of its contractors. That contractor is now quarantined and is awaiting test results. In other news, Minister of Finance and the Public Service Dr. Nigel Clark says governments will be extending the grace period for the repayment of loans from the Student Loan Bureau during the 2020-2021 fiscal year.
What we are going to do, Mr. Speaker, is that we are changing, Mr. Speaker, the period by which students have to start paying back their student loan, Mr. Speaker. Students will now have 14 months, Mr. Speaker, from graduation to begin repaying their student loans. Mr. Speaker, we believe that this change will allow the Student Loan Bureau to continue to fulfill its mandate to sustainably increase access to tertiary education in Jamaica. Mr. Speaker, Jamaica is moving in the right direction.
Dr. Clark was opening the annual debate at Gordon House Tuesday afternoon. 5 employees of the Tower restaurant on Knutsford Boulevard in New Kingston are recovering from injuries following an explosion at the establishment Tuesday afternoon. Public Relations Officer for the Jamaica Fire Brigade, Emilio Ibanks, said they were injured by flying debris caused by the blast. Fire investigators are trying to determine whether a gas leak caused the explosion. And in Living Healthy this week, we explore treatment and prevention methods for the novel coronavirus, also known as COVID-19. In this report, we'll learn about the coronavirus from the World Health Organization, the WHO.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
The US dollar on Tuesday, March 10, ended trading at $135.42, up by 37 cents. According to the Bank of Jamaica's daily exchange trading summary, the Canadian dollar ended trading at $99.62, down from $100, while the British pound sterling ended trading at $176.71, down from $177.55. In regional news, Acting Chief Justice Roxanne George Wilshire will on Wednesday decide whether or not the injunction granted to a supporter of the main opposition People's Progressive Party Civic to block the Guyana Elections Commission from declaring the results of last Monday's regional and general elections was justified on the grounds that the votes declared for Region 4 were not completely verified. We get more in this report from the Department of Public Information's Senika Thorne.
After hearing oral submissions on whether the Region 4 returning officer Clement Mingo acted in accordance with the law when he declared the result for that district, Acting Chief Justice Roxanne George said that she will make her final ruling at 2 p.m. on Wednesday. Senior Counsel Neil Boston and Attorney-at-Law Robin Hunt appeared on behalf of GCOM, the returning officer, and the Chief Election Officer Keith Lowingfield, the respondents. The opposition lawyers, Trinidadian Senior Counsel Douglas Mendez, and Attorney-at-Law Anil Nandlal and Sanjeev Datadin represented Riaz Holodar, the applicant. The opposition argued that Article 841 of the Representation of the People's Act was not followed. This section deals with the completion of the counting process in the presence of all the relevant agents. However, Senior Counsel Boston contended that there was substantial compliance by Mr. Mingo during the verification process and that he was not obligated to sit and go through a process with the parties regarding what was recorded from the statement of polls.
Mr. Mingo, from Monday night, after the statement of poll came, to the command center. He worked until about 3 a.m. Tuesday. He came back Tuesday morning about 9 o'clock and he worked again. And this is the evidence of everybody. He worked in the night. He came Wednesday again and he worked. And then there was bacchanal in the place. PPP people, Kwame Cousin. People called him Vala Lawrence, she want thief at the election. People, so what must he do? He doesn't have to come and sit with them and go through a process of disagreeing with them, that this is what I have recorded from the statement of polls that was sent to me. He has to rely on those statement of polls that were sent to him from the various districts in Region 4. If there are discrepancy, as he called from his spreadsheet, and it doesn't correspond with theirs, he has to abide by his statement of polls. And the statute gives them a remedy if they don't agree with it. Come to Section 84(2) and ask for a recount.
The opposition also suggested that the final tabulation of the results was done by the deputy returning officer. Boston disputed the statement, saying that there was no evidence of such an act.
All Ms. Miller did was input the information into the computer, and then it was inputted into a spreadsheet. But there's no, she didn't say she counted. There's no evidence that she counted. Mingo said, I have complied with 84-1.
Barbados could fall short of its target under the International Monetary Fund if COVID-19 reaches its shores. As such, Prime Minister Mia Mottley said she will negotiate with the fund to get an ease on the targets set under the 4-year program. She made the announcement following a closed meeting with stakeholders in Bridgetown on Wednesday.
So whether we run a 6% primary surplus or a 4% primary surplus or a 3% fiscal primary surplus, we are still paying down our debt. But what we need now is a little elbow room to ensure that households do not fall through the cracks, to ensure that businesses are not pushed into bankruptcy en masse, to ensure that we can sustain life, sustain and protect our people, and allow them to live while the world finds the solution for the vaccination that will hopefully bring this madness to an end. And I do believe, quite frankly, there is a level of global panic. And I hope and pray that that panic will be brought back and that we will start to act in context.
Ms. Mottley said she's hoping that negotiations will lead to a lowering of fiscal targets as well as the chance for precautionary standby financing. Panama's health minister on Tuesday confirmed 8 cases of the new coronavirus in the country, including 1 death, the first virus-linked death in Central America. She's quoted saying, "Of the 8 patients we are reporting, 1 person is in intensive care, another unfortunately died," end quote. According to the ministry, a 64-year-old man who was already suffering from diabetes complications associated with bacterial pneumonia died of COVID-19 virus on Sunday. The other 7 people who tested positive ranged in the age of 29 to 59 and had each recently traveled abroad. The Panamanian government ordered public and private schools closed until April 7 in the affected areas. The health ministry, meanwhile, called on the population to remain calm and follow prevention protocols. The Ministry of Health in Trinidad and Tobago have revealed that 8 people in Trinidad and Tobago remain quarantined since the outbreak of COVID-19. More in the support from TTT News. Health Minister Terence Dayal Singh was speaking at a media briefing on Wednesday.
The Ministry of Health has reaffirmed that while there are no cases of COVID-19 in Trinidad and Tobago, it can forcibly detain suspected carriers of the virus who attempt to defy its quarantine measures. 20 people have been quarantined since government used this measure to prepare for the possibility of an outbreak of COVID-19. Of the 20 persons, 8 are still at home under quarantine, while another 10 persons have been prevented from entering Trinidad and Tobago. This measure was made possible in January this year when COVID-19 was added to the list of quarantinable diseases under this country's Quarantine Act. Chief Medical Officer Dr. Roshan Parasram says while all 20 persons quarantined so far have complied with the law, the Act allows government to detain those who do not.
If the need arises, the Minister of National Security has assured the Ministry of Health that the necessary steps through the Defense Force or the Trinidad and Tobago Police Service will be taken to have persons stationed outside of their home and guarded 24 hours a day to ensure that they stay there. That issue has not come to bear with the cases that are being quarantined at present. But we can go that far. We can actually take you out of your home to a hospital isolation under the Quarantine Act if need be, as well as another tier of isolation.
Dr. Parasram said these measures apply to persons who enter the country at known ports of entry. He also spoke to how government will deal with illegal immigrants who may have COVID-19.
It's very difficult for us to tell, illegal ports of entry. We're dealing with illegal ports of entry at this point. National Security has increased their patrol. I don't want to speak for National Security as to what measures they have put in place, but they are aware of the issue and they have increased their vigilance in that regard.
Dr. Parasram heads an interministerial team which includes the Ministry of National Security, which meets on the COVID issue on Thursday. Vidya Ramphal, TTG News.
In sports, Jamaica will not participate in the Penn Relays this year due to the coronavirus. Minister of Health and Wellness, Dr. Christopher Tufton, made the announcement at a press conference where it was disclosed that a female patient had tested positive for the virus, becoming Jamaica's first case of COVID-19. The Penn Relays are scheduled for April 23 to 25 in Philadelphia in the United States. Dr. Tufton says a decision will be made about the Issa Grace Kennedy Boys and Girls Athletics Championships and all other public gatherings. The popular event is slated for March 24 to 28 at the National Stadium in St. Andrew. And that's the news on PBCJ. Thank you so much for watching.